today. As you know, a couple mosquitoes in Jefferson County have tested positive for West Nile virus. Here to talk about it is Connie Mendel. She's our Chief Health Strategist, and we have our Associate Medical Director, Dr. Christina Bryant, joining us too. And so we're going to start off with Connie, who can give us a situation update. Connie.
Sure, thank you. So yes, as Kristen mentioned, we have identified West Nile virus within mosquitoes that we've collected in the 40214 zip code. It's not unusual for us to collect mosquitoes this time of year that test positive for West Nile virus. Unfortunately, West Nile is endemic to our area, meaning it's something that we see every year. Luckily at this point, we don't have any human cases of West Nile, but it's important no matter what zip code that you live in, that you protect yourself against mosquito bites. So what we like to say, I like to use the 3 Ds, and that's drain. Drain, get rid of any standing water in and around your yard. Look for whether it's children's toys, pools, tires, water, water fountains, bird baths, gutters, particularly those that are clogged. Do whatever you can to drain water, because that is where mosquitoes lay their eggs and breed. Then the second D is defend. So be sure to defend yourself by wearing insect repellents, those containing DEET, Picardin, and others. Just make sure that those are EPA registered. And also defend your home. So if your windows are open, be sure that you've got really good screens. And also we talk about dress. So the third D is dress. Whenever possible, wear clothing that will protect yourself from mosquito bites. So long sleeves, long pants, and socks. And then just try to stay inside, away from mosquitoes when they're most active, which is going to be in the early morning hours and right before dusk and at dusk. So. Does anybody have any questions, or I can pass it on to Dr. Bryant to share some of the medical information regarding West Nile?
Yeah, that would be great, Connie. Thank you. Yeah, Dr. Bryant, can you go ahead and go over some of the signs and symptoms we should be watching out for?
Yeah, sure, Kristen. Thank you. As Connie said, West Nile is the most common mosquito-borne illness that we see, not just in this area, but across the U.S. Now, most people with West Nile have no symptoms. Only about 1 in 5 will develop signs of illness, and common signs include fever and flu-like illness, headaches, muscle aches, vomiting and diarrhea, maybe a rash. People with mild illness likely never get tested for West Nile, and therefore we don't count them as West Nile cases. About 1 in 150 people will develop severe illness, and severe illness can include meningitis or encephalitis, an inflammation of the brain, and this can actually be life-threatening. People over 60 and people with chronic medical conditions, so chronic renal disease, cancer, high blood pressure, these are people who are at more risk to develop severe disease. So it's important for everyone to protect themselves.
Great, thank you, Dr. Bryant. We'll open it up for questions now.
Hey, Connie, it's Paul. Can you hear me?
Yes, I can.
This is not the first time that the West Nile has been detected this year in the city, or is it?
This is the first time this season that we've detected mosquitoes carrying West Nile. Yes.
And the season runs from when to when?
Oh, we look at it as a calendar year. So in some areas, mosquitoes are around year round. Luckily for us, we do actually have a mosquito season. So we begin treating for them sometimes late March, early April, as we treat what we know are known or historic breeding grounds, just areas around the city and throughout Jefferson County where we know typically are flood prone areas. And then we collect mosquitoes again throughout this May through sometimes into November. It just depends. It's weather dependent.
And you sort of you answered my last question was where are the surveillance traps located in the county?
Yeah, we have multiple traps located. Some are what we call that we use those historical areas where we found West Nile positive mosquitoes before. Wooded areas, flood prone along the river.
About 10 minutes late to the party.
But throughout the county, and then we'll also set up intermittent traps based on complaints or areas where our environmental health specialists detect mosquitoes.
Dr. Bryant, when was the last time we've had a serious illness or death related to West Nile in the city?
No. We may have lost Dr. Bryant temporarily, but I can answer that question.
Okay.
So last year, we actually, in 2002, we did have 3 cases of 3 people who tested positive and 1 severe case leading into the person unfortunately died. So in 2022, we had 3 cases with 1 death.
Is that an unusually high or low number?
It's a little high, but I will say, you know, typically we see anywhere from 1 to 3 cases a year. And so last year, you know, 3, back in 2018, we have 5 cases. So it's just, you know, West Nile is here to stay, unfortunately, in this area. It's what we refer to as an endemic disease.
And what makes it particularly severe or dangerous for certain people? How is it there are some cases that, like last year, there were 3 serious illnesses and 1 death? Why is that?
And you know, as Dr. Bryant discussed, there are likely more cases going on that they go undetected because it's a mild virus. For older individuals, it can be much more serious, or for individuals who have a immune system, you know, if they recently are suffering other illnesses, you know, particularly someone who's had an organ transplant. So if you have a compromised immune system, you could have more serious effects.
And Dr. Bryant may have brought this up previously, but how do I know if I have the virus?
I mean, to be certain, you would undergo testing, but the symptoms, as she mentioned, were headache. It could be muscle aches, flu-like symptoms early on that become much more severe with pain, and can lead to an encephalopathy with a swelling of the brain. So, you know, if someone continues to have symptoms, as far as, you know, anytime you would have extreme headaches and muscle aches and extreme flu-like symptoms, you would want to seek a medical provider to determine if it's West Nile or other disease.
Thank you.
Kristen, can you tell if Dr. Bryant is?
Dr. Bryant, are you on? I think she may be reconnecting.
Okay. Yeah. One of the most important things we want to share is that, yes, we did identify it in the 40214 area, but regardless of where you live, whether it's Jefferson County or surrounding counties, you want to protect yourself against mosquito bites. So mosquitoes don't recognize county lines or zip code boundaries. And anywhere in our area, the mosquito that carries West Nile does proliferate in our area. So again, do whatever you can. Going back to those 3Ds, draining any water, defending yourself with, particularly with insect repellents if you're going to be out and about while mosquitoes are biting, and dressing to where you can to prevent bites.
Does anyone else have any questions? All right, it looks like Dr. Bryant is joining us again. Does anyone have any other questions for Connie or Dr. Bryant? All right. And we recorded this, so if you had issues on your end, please reach out and we can send you the recording. Otherwise, thank you everyone for helping us get the word out.